Today I just wanted to bring to your attention a new article that's been published that links people's body weight to their diabetes progression. Now what the authors set out to do was look if we can predict how someone's body mass index or their BMI or their body weight essentially contributes to the progression of their diabetes long term. So in other words, can we predict the rate at which someone's diabetes will progress based on their body weight before they were even diagnosed? And if we can do that, we can then start to target these individuals and prevent complications with the diabetes and also save the NHS millions of pounds. We've known a long time that lifestyle choices are the biggest contributor to type 2 diabetes. 80 to 90% of individuals have it because they're overweight or obese. And the reasons are simple. You carry too much fat around your liver, your pancreas, your other organs, and also this fat gets into your body cells which starts to clog them up. The researchers looked at 410 patients and they wanted to see if they could predict patients' insulin producing capabilities, so that gradual decline of insulin production as the disease gets worse, based on their body mass index before they were diagnosed. So the researchers started to look back at these patients' body mass index prior to diagnosis and took the maximum one. They then also compared this to their current body mass index in hospital. The researchers then started to look at the patient's insulin producing capabilities, and they did this using a C-peptide test. C-peptide is basically a protein that's joined to insulin as it's released from the pancreas. Then after it's released, C-peptide breaks away from the insulin whilst the insulin goes away to do its job, and then what we can do is measure the C-peptide that's remaining to get a surrogate marker of how much insulin you're producing. Remember, the researchers were trying to see if there was a link between people's BMIs before diagnosis and the rate of decline in their C-peptide score. They therefore started to separate patients into BMI categories based on whether they were underweight, normal weight, overweight or obese prior to diagnosis, but then they also looked at their current body weight whilst they were in hospital, which is when the researchers recruited them. The first thing they found was people that tended to have a higher BMI prior to diagnosis also tended to be more overweight when the researchers picked them up in hospital. So in other words, people that were overweight before tended to stay that way. Unfortunately though, based on this BMI prior to diagnosis, they could not find any link between the BMI then and the rate of decline in their C-peptide scores. So they couldn't prove a link between pre-diagnosis body weight and how quickly the diabetes would progress. That said, they did find the patients with the highest BMI in hospital also happened to have the lowest C-peptide scores. So there was no link between the rate of decline, but there was certainly a link between body weight at that current point and their insulin producing capabilities, with those that had the highest body weight being the least able to produce their own insulin source. They also found that the people that were most overweight were the most likely to develop diabetes earlier in life, so they were younger upon diagnosis. Now this is significant because the earlier you develop diabetes, the longer you have to live with higher blood glucose levels. Therefore, there's more potential for damage and complications. This is why prevention and lifestyle interventions at an early point are so critical with type 2 diabetes. Lastly, the researchers found the longer you had diabetes, the lower your C-peptide score was. So the people that were diagnosed earlier in life and had it for many years were much more likely to see a progression in the disease. What does this mean for patients? It means if you have diabetes and you're overweight, you should start trying to lose weight as soon as possible. We used to think type 2 diabetes was a progressive disease, i.e. when you got it, it would only get worse. But now we can see it exists on a scale which you can slide up and down on depending on how healthy and active you are being. So the people that are living the healthiest lives and being as active as possible can actually turn back the clock on their diabetes. The point at which you can turn it back to will depend on the individual, how long you've had it, and those insulin producing capabilities. But some people, particularly those that are newly diagnosed, and by newly diagnosed I mean in the last 5 to 7 years, can actually push it back into remission. It also shows us prevention is the best cure. Therefore, making lifestyle changes and trying to get active can either severely delay the onset of diabetes or prevent it altogether. The study also reiterates 2 of the key features as to why diabetes develops and progresses, one being insulin resistance and 2 being the pancreas tiring out and producing less insulin. Focusing on that second point there with the pancreas tiring, this is really crucial because what happens is, as your pancreas starts to tire out, the beta cells which release insulin start to fail. Now, the degree of failure will vary depending on each individual and how severe the diabetes has become, but we do see incidences of people going from type 2 basically into type 1 as their pancreas just flat out wears down. Now, it doesn't mean it's too late to make lifestyle changes, but it does mean that you have reached a point of almost no return in terms of losing that function to produce insulin. But it does mean that you can still address that insulin resistance, so the insulin that you are producing is still working better and more efficiently, which will help to reduce your glucose levels. So essentially, it's never too late to start making lifestyle changes to improve your condition, but ideally you're catching it before that pancreatic beta cell failure or wear out, so you're still producing as much insulin as prior to when you were diagnosed. Problems with the study. The study does have some problems. For starters, it was quite hard to read and I wasn't exactly sure what they did. I think they could have been clearer with how they put across their method and their protocol, and actually what they were trying to achieve. So to my mind, they were looking at the body mass index and the link of decline, the link with the rate of decline in people's type 2 diabetes. But really what they've actually shown is if you have a high BMI pre-diagnosis and also have a high BMI later on in diagnosis, your chances are that your diabetes is going to progress. So maybe that's all they needed to show, because now we can target those patients regardless of the rate of decline and actually try and put some interventions to catching people early and prevent that progression happening in the first place. So it's almost neither here nor there at the rate at which it happens. It'd be nice to know, but in reality, we know it happens and therefore we need to be targeting these people as soon as possible. The study was also an observational study, which means basically the researchers took real-world data, sat back and analysed what happened. Now this is good because it gives us real-world findings, but it's also not so good because then there's a bunch of other variables that could contribute to the results. So they have to apply a bunch of fancy statistics to try and eliminate these extra variables to just narrow down the only variables that they want to look at, which is body mass index and C-peptide. It's also a reasonably small study. 410 people isn't a terrific amount of people when you consider the hundreds of thousands or millions of people that big pharmaceutical companies will look at when they're doing their big drug trials. Nonetheless, it does give us some good insights and actually reiterates a lot of things that we thought we already know about diabetes. So again, it just takes that knowledge base a little bit further and just confirms what we thought we already knew. In summary then, really it would be great to start trying to target and help these individuals that suffer with their weight early on in their diagnosis or even before they have been diagnosed. We know they have these risk factors. We know that being overweight or obese can lead to diabetes if you also have the genetic makeup which will trigger type 2 diabetes to happen. So getting in there early and helping these people will help prevent delay or prevent type 2 diabetes happening for a lot of people, which will help improve their quality of life long term, prevent complications, and also save the health service lots of money. And that's it everybody, I hope you've enjoyed that. If you haven't done so already, remember, check out the blog, diabetesdietguide.com, loads of free information about managing diabetes and healthy living for you. If you need a further helping hand, I offer one-to-one consultancy services and also programs which act as step-by-step guides to take you from your current position to your goal, which at the moment, at the time of filming, we have our type 2 diabetes recovery program, which shows you exactly how to manage type 2 diabetes. And soon we're going to be publishing our winning weight loss course, which does the same thing, but with weight loss. So I'm going to leave it there for now, guys. So I'll see you later and I'll see you at the next blog.